While you are not speaking, I'm requesting you all to just keep your mic off. You can turn off or turn on your mic only while you have to speak. Can we start now?
Yes.
Yeah. Everyone, I am Samiksha Singh, and it's my pleasure to moderate today's roundtable on early diagnosis and timely intervention. This dialogue is an initiative of the Integrated Health and Wellbeing IHW Council, powered by Paras Health, with a shared objective of strengthening awareness around early symptoms recognition, timely medical action, and patient-first outcomes. Today's conversation bring together experts across international medicine, in emergency care, oncology, neurosurgery, and gastroenterology. Discipline that collectively see firsthand how early decisions can change the course of illness, reduce complication, and save lives. I am delighted to welcome our distinguished panelists from Paras Health Panchkula. So we have Dr. Navneet Arora, consultant infectious disease. We also have Dr. Chetan Goyal, Associate Director Emergency and Critical Care, joined by Dr. Rajeshwar Singh, Director Medical Oncology. We also have Dr. Ankit Kumar Gupta, Consultant Neurosurgery, joined by Dr. Akesh Gandotra, Consultant Gastroenterology and Hepatology. Thank you, doctors, for joining us and sharing your expertise. With that, let's begin this important discussions. So, my first question will be from Dr. Navneet Arora. Sir, from an infectious disease perspective, what early symptoms are most commonly ignored that later progress into serious illness?
This is a very good question, and by your forum, I would like to tell everybody that from an ID or infectious disease perspective, we should be very aware of the warning signs which are associated with any infection. So, at home, to suspect any infection, you should look out for fever, which is the layman term, like which is the layman thing which people look out for. Along with that, if you have any fever which is lasting for more than 3 to 7 days, any fever which is lasting, sorry for the interruption, any fever lasting for more than 3 to 7 days, or along with that, you have warning signs like vomiting, blood in stools or blood in vomiting, giddiness, letharginess, or altered mental sensorium, meaning that you are not aware of your surroundings. So these are the warning signs when you actually should need to rush to the hospital or to the ER, or you have fever for more than 7 days or like around 3 to 7 days. At that point of time, the first consultation is required. So these are the signs which you should keep in mind at home and to see whether the disease is progressing or not.
Thank you, Dr. Arora. My next question will be from Dr. Chetan. Sir, from an emergency department's viewpoint, what delays most commonly worsen patient outcomes before hospital arrival?
So there are few illnesses which are time sensitive for the management, like myocardial infarction, इसको हम heart like बोलते हैं, stroke, which is like supposedly a clot in the blood vessel of the brain, or trauma, where there is golden hour. This outcome is very different. Our initial few minutes is very prompt and effective. So the patients have few problems while deciding coming to hospital. So they don't decide to come to hospital. There are misinterpretation of symptoms. They don't understand the seriousness of the symptoms. Then they follow the wait and see approach. They follow the wait and see approach. Then they sometimes prefer to contact their family physician first. Then they decide to go to a big hospital. Sometimes they don't use appropriate ambulance services to reach the hospital. Sometimes there is delay in inter-hospital transfer is delayed. They are into community hospital and they are not getting discharged, and then they are not being referred to the appropriate place. And you know that in India we do have a problem with the traffic and the road conditions. Sometimes transportation to the hospital is a challenge. You must have heard that VIP movement causes the delay in, makes the ambulance stuck in the jam. So all these challenges make the reaching the patient to hospital delayed, and hence the treatment is appropriate treatment is delayed.
Thank you, sir. Now moving to Dr. Rajeshwar Singh. Sir, why do many cancer patients reach oncologist at an advanced stage despite early warning signs?
Okay, thank you very much. So basically, cancer, we know that is spreading very fast. And the main reason is, of course, the delay in diagnosis of cancer. There are many factors. First of all, cancer doesn't have one symptom. Cancer can have vague symptom which patient might not understand, and they treat a normal like fatigue, loss of weight and fatigue as a normal thing in life. So they don't recognize there is lack of awareness in this. So that is one main reason. Secondly, like I said, the awareness is not there. They are not been told what is the warning sign, what cancer can cause, how it can spread. So they keep treating or they're getting treated from people who are not qualified enough. So they come late. Then there are personal factors. Like, for example, there is a fear. Ladies don't get any test done because they think that something will come out in that test. It is not the test which will get the cancer. If you have early disease, you can detect early if you get this test done. Then there's a denial. Denial in the sense that patient thinks that I will not get cancer, other people will get, relatives will get, other will, but I will not get. But no one is immune from cancer. I have seen cancer at the age of 6 months to, of course, as the age grows, the cancer increases. So denial is also there. Then in our society, it's a stigma. स्टिग्मा अगर किसी को कैंसर हो जाए तो कोई मेरे से बात नहीं करेगा, लोग आगे पीछे के मेरे से मिलेंगे नहीं, मेरे को शन कर देंगे, और आई विल बी आउटकास्ट इन द सोसाइटी. सो दिस इज ऑल्सो अ मेन रीजन ऑफ दिस. Then our healthcare system, the primary healthcare system where the primary health centers are there, they're now they are coming up recently, but still they don't tell patients what are the warning sign, how to, if there is a possibility of cancer, how to look for the cancer. So we have to do much more in that. So patient first they are seen by quacks, and quacks keep giving treatment, and by the time they reach to us, it is very late. So we have to improve our health system at the basic level, that the primary health center where awareness of cancer is required to be brought. Then apart from that, you see, there is a some amount of, as far as female health is concerned, we have some much more required to be done. Because female cancer, the commonest two cancer are the breast cancer and the cervix cancer. Because of issues like they are ashamed to tell other people. And secondly, even if they tell people, the ladies are not brought to medical attention very early. So this also we require to change at a very basic level. Then, of course, the financial issues are there. Financial patient don't have money to get treatment for or investigation. Insurance is not there. So we have to do much more. Of course, the government of India is doing Ayushman. A lot of patients are being benefit, but still more requires to be done. And finally, what I think is why the patients are coming late is because some cancer are very fast. You see, they're very
Spread fastly. Yeah.
aggressive. So by the time patient notice, they already spread here and there, like especially the pancreas cancer and the blood cancer. So that is how they come to us very late by the time cancer is advanced, in spite of warning signs.
Thank you, Dr. Singh, for highlighting how awareness is important while we're talking about cancer. Now moving to Dr. Ankit Kumar Gupta. Sir, which neurosurgery symptom should never be delayed or ignored, regardless of age?
Hi Samiksha, thank you for a question. My name is Dr. Ankit Amar Gupta. So the constellation is actually a constellation of symptoms, not a single symptom per se, and they can depend on what kind of symptoms you're getting for brain and spine. So we can divide the symptoms in two broad categories. For spine, any patient who has developed any acute loss of limb power or weakness, or has lost control of his bladder or bowel function, these patients should seek consultation immediately. For brain also, there are a constellation of symptoms. There can be a severe headache, which can be sometimes be accompanied by projectile vomiting, which may have patient have blurred vision, double vision, or any focal neurological deficit which the patient develops, which can be related to any of the cranial nerves, which can be the facial nerve or the muscles that control the eye, the tongue, the mouth, or any long tract nerves which include the sensory and motor power of the body. Especially if the patient has a constellation of these symptoms, he should seek care immediately. And obviously, patients who are having any active seizure or fever which is uncontrolled, they can be also suspicions of having any neurosurgical or neurological disease. They should reach a hospital as early as possible and get evaluated by a proper physician and a neurosurgeon.
Yeah, thank you, sir, for highlighting this important point. Now moving to Dr. Akash Gandotra. Sir, why are liver and gastrointestinal diseases often diagnosed late in India?
Hi, good afternoon. Am I audible to all of you?
Yes, yes, you're audible.
Yes, so thank you for the question. The liver and GI diseases diagnosis often usually get delayed because I think people don't have enough education regarding the common liver and GI diseases. So what basically happens is there are two types of individuals or patients. We categorize them high risk or low risk patients. So high risk patients would be those who are obese, who have diabetes, who have cardiovascular disease, those who are consuming alcohol in very high amounts, those who have family history of liver disease or any other GI disease, for example, cancer or any other disease. So these patients should seek attention early because they are a high risk group. Now, low risk group would be those who do not have these kind of background. They don't consume alcohol in very high amounts. They don't smoke. They are not obese, but yes, they have fatty liver. So these kind of low risk patients should get their liver screen or GI screen once per year, so that they can be diagnosed early if they are developing any kind of early disease, because these patients do not have early symptoms. Fatty liver disease patients usually would not present to you unless they have jaundice, unless they have severe abdominal pain, unless they are having serious issues. So because these diseases usually do not present early as most other diseases, for example, cardiac disease, patient usually would develop chest pain or breathlessness, so they would arrive early to the hospital. Fatty liver disease or liver cirrhosis in early stages would not present because these patients usually do not have that kind of symptoms. So my advice would be that these high risk patients should get evaluated, every 3 monthly, get their screen done, and those who are low risk, they should get their liver and GI screen done once in a year. Yeah.
Thank you, Dr. Akash. So, from first round of question, this is very clear in average disease perspective that awareness is very late in India and especially in the patient. They are not aware exactly which disease can come out in which consequences. Now, the round two question is about consequences of delays. So, my first question will be from Dr. Navneet Arora. So, sir, how do routine infections escalate into life-threatening conditions like sepsis due to delayed diagnosis?
So over here, we have to come to a conclusion, to a point that whenever infection or any medical condition is not diagnosed or not dealt with in the initial stages, it progresses. So it is just like a fight between your body's immunity versus the supportive care with the medicines versus the infection which is being caused. So either of the one would win. There will not be a status quo in the body system. So if you are not treating the infection at the grassroots level or at an early stage, it will definitely proliferate. It means it will definitely multiply in your bloodstream or in the organ the infection is caused, and it will spread to other organs, which is known as sepsis. And this resulting spread of the infection when reaching the multiple organs like heart or the brain will lead to subsequent consequences in the form of lowering your blood pressure, that is shock, or in altered mental sensorium, meaning irrelevant talks, that is septic encephalopathy. So, whenever the infection is not controlled at the initial stage, not diagnosed at the initial stage, or not appropriately treated at the initial stage, it will lead to sepsis or septic shock with multi organ dysfunction syndromes.
Thank you so much, sir, for highlighting this topic. Now, moving to Dr. Chetan Goel. Sir, why is the golden hour so critical, and what should families ideally do while emergency help is on the way?
So, golden hour, especially in the case of trauma. Trauma is like road traffic accident, fall from height, or some injuries. So that time, the first 60 minutes are very crucial for a good outcome. If we act on a time, the chances of complications, death, morbidity, and mortality, and organ dysfunctions are decreased. So the aim is to prevent irreversible damage. We can uh, till the time the ambulance is on the way, they first of all, for every situation, the first step is do not panic. Act wisely, do not panic, and do not let others also panic. Number two, maintain the airway. This there is a basic skill every person should know how to maintain the airway, how to check for the response, how to check for the pulse, and if there is no pulse, no breathing, no circulation, that time start chest compressions. So this is the basic thing that everybody on the like in the every country should learn how to start with the first aid like basic life support. Then if we act on time, we can decrease the mortality by 25%. We have to ensure that severe bleeding is controlled. Most of the time, severe bleeding can be controlled by applying a direct pressure on the wound. You have to keep the limb straight, and as well as you can also, in the case of stab wound, like somebody has been hit by a knife or a stick, that time you should not actually try to remove that equipment from the body. Let it be there. Seek early medical help, and other important thing is position of the victim. The victim should be laid supine with minimal movement of the neck, minimal avoid unnecessary movements, and try to maintain the circulation and airway.
Thank you so much, Dr. Goel, for breaking this term in a simple way. Now, moving to Dr. Rajeshwar Singh. Sir, which cancer symptoms are most frequently ignored by patient and families? Sir, you are on mute.
This is an important question. You see, we must understand that cancer is not limited to one organ. It can occur any organ and any part of the body. So the symptoms are also so variant. Since we should not ignore any symptoms, especially these are very subtle symptoms which can mimic normal day-to-day diseases which we get. So one may think that backache is because of those spine problem or some problem. So the commonest symptoms which are there is, say, loss of weight. It is very important that patient in cancer, generally they lose weight in 90% of the patient. And whenever there is a loss of weight of more than 10% in 6 months or 5% in 1 year, so one must be careful, one must go to doctor. He may not have any other symptom, only weight loss is one symptom. So he should meet his doctor and discuss why weight loss is there. Then persistent fatigue. Fatigue is very common for many ailments. But if it lasts for more than, say, a month or so, person is having a persistent fatigue. So that is again a very subtle sign that we can have a cancer. Apart from that, if there is a lung cancer, we generally have cough and patient of smokers, they generally keep coughing here and there. So they can't make out difference whether it is a cough is because the smoke or smoke which has got cancer now, it has aggravated. So whenever there is a cough associated with any blood coming into the sputum, or there is a pain chest, or you have a breathing difficulty, please watch out, you can have a lung cancer. Similarly, if there is a altered bowel habits, that is, you have constipation alternating with loose motion, so there is a possibility of a abdominal, that is a colon cancer is there. Any pain abdomen or pain any side which is persistent for long duration, it may be very low grade pain, say abdomen pain, which is going to back. It can be a pancreas cancer or cancer of abdominal organ. Similarly, any bleeding from any site, if bleeding is there and it is continuing for a week or so, you must be concerned, say if it's from the mouth for the lung cancer or from urine or stool, one must get concerned about this. Generally, people ignore this symptom, but these are not to be ignored. And then, apart from these symptoms, you can have a persistent fever which is lasting for many days. And if it is not going, then possibility of cancer should be camped. Sometimes these subtle signs like night sweats, patient get night sweats. That is also one of the signs that you should not ignore, because night sweats are associated with many blood cancer and lymphomas. So these are the main symptom. And if there is any lump in your body, especially female should examine lump. And if it's a lump in the body, in the breast or armpits, or any part of the body which is not going for many days, so it is a sign of possibility of a cancer. So we should be concerned and show ourselves to a medical profession immediately.
Thank you so much, Dr. Singh, for highlighting which symptom can lead to what consequences. Now moving to Dr. Ankitama Gupta. Sir, how does timing impact outcomes in brain and spine conditions?
Thank you, Samiksha. So Dr. Chetin highlighted some of the points. He very adequately explained the importance of maintaining the airway and proper transportation, a quick transportation of the patient to a hospital. So all these things affect the patient's overall outcome eventually. But in terms of neurosurgery, we can find that any patient who has some sort of a mass or a lesion in the brain or a spine, any brain tissue which is not getting proper oxygen for more than 8 minutes will have some degree of permanent damage. So hence we should seek intervention as early as possible, particularly in my case. In my case, if I get a patient who has some sort of a road traffic accident and he develops some sort of a extradural hematoma, my target is to take the patient to the operation theater and place the burr and remove the bone as quickly as possible. So the targets I try to achieve are sometimes as low as 20 minutes from the time of arrival to the start of surgery. So similarly, I would like to highlight any patient who is having any sort of a spine emergency should seek treatment, because if the patient has any weakness or a loss of bladder bowel function that lasts more than 24 to 48 hours, then the chances of recovery become less and less as the timing of the surgery gets delayed, because any such mass effect will eventually affect the vascularity of the brain and spine. And once the vascularity is affected, the patient does form some sort of a stroke, and which leads to a permanent sequelae or a damage to that particular organ.
Thank you, Dr. Gupta, for highlighting how timely action is important. Now moving to Dr. Akash Kandutra. Sir, what early digestive and liver-related symptoms are commonly overlooked?
Yes, so many of the symptoms have already been told by Dr. Rajeshwar sir. So I'll highlight most of the liver diseases symptoms. So early symptoms in liver disease would be easy fatigability. Thakan, usually patients complain that we get fatigue easily. Second would be dull aching abdominal pain on the right side of the abdomen, usually. Third would be jaundice. If somebody is getting yellowish discoloration of eyes or urine, dark colored urine, then he should think of liver disease and should get himself or herself treated for that. In cases of advanced liver disease, people usually get swelling in the legs, maybe some abdominal distension, fluid in the abdomen, and obviously jaundice and some other symptoms. So these are advanced stage diseases, but early would be mild jaundice, early fatigability, loss of appetite. Sometimes patients do get weight loss also. So these are some of the early diseases in case of liver diseases. If we talk of a GI tract, so in that case, GI tract usually starts from mouth till anus. So patients would have symptoms related to esophagus, patients would have related symptoms to stomach, intestine, है ना? So in that case, if there is difficulty in swallowing liquids or solids, that is a symptom for a disease inside the food pipe, that is esophagus. If patients are developing weight loss, loss of appetite, there is sudden weight loss, 10 kg, 15 kg, patient is not able to eat, then it's a symptom of digestive tract disease. If patient is having bleeding from any side, like a oral bleed, for example, bleed in the vomiting, or sometimes patients get bleed during defecation when they pass stools. So they sometimes overlook it with कि हमें तो piles है, hemorrhoids है, fissures हैं, but they can be something else also. So in case of any bleed, even small bleed, patient should get himself or herself treated early. Other than that, as Dr. Rajeshwar said, pain abdomen, diarrhea, altered bowel habits. If the patient is having diarrhea for too long, like more than 2 weeks, 3 weeks, diarrhea, not getting treated with the usual antibiotics and usual treatment, that may be a sign of early digestive tract disease. If the patient is having constipation, prolonged constipation, not getting relief with the laxatives, or the patient, along with the diarrhea and constipation, developing weight loss, loss of appetite, any bleeding from any side. So these are early symptoms, early signs of digestive tract disease. So these patients should get themselves treated early.
Thank you so much, Dr. Akash, for highlighting how we should keep looking for that early signs. Now moving to round three questions where we will be discussing about role of early action and systems. So my first question will be to Dr. Navneet Arora. What role does timely testing and follow-up play in preventing complications in infectious diseases?
So this question will be divided into two parts. First part would be the timely investigations, and the second part I would be answering in the form of the follow-up. So the timely investigations are very important to know what infection is there. So infections can be bacterial, viral, protozoals, fungals. There are many type of infections which can affect you and which presents as fever. So the fever or the infection coming from what source of organism is very important for the treatment aspect. So once you isolate the etiology, that means once you isolate the organism or the bacteria or whatever the cause of infection is, the treatment becomes very easy and it becomes very targeted. And this is the role of investigations in an infection. Now coming to the follow-up. Once you are discharged or once you have an infection, your body becomes prone to secondary infections. Like virals are known to cause secondary bacterial infections, which can be over the viral infections which are earlier caused. So follow up with a doctor or with your healthcare professionals. Tell you whether you are going on a descending, that means a downward trend after curing the infection, or you are getting an upward trend, that means you are getting better after taking the treatment. So by the follow up, the doctor actually sees whether the infection is getting cured or you are getting reinfected with some other infection. So this is the importance of follow up, which should be there in the treatment. So the follow up is a very important component of the treatment which a doctor gives you, and hence the investigations and the follow up should move side by side.
Thank you so much, Dr. Arora, for highlighting how timely testing is important in infectious diseases. Now moving to Dr. Chetan Goyal. Sir, what are the biggest misconceptions families have about handling medical emergencies in your experience?
Uh, so most of the times, families think emergency care is only for severe infections. My problem is not that severe. We will consult our family physician first, then we will go to the hospital. And there is a mindset that emergency care is always expensive. Secondly, there is a problems to settle, settle themselves. So they try to ignore the important uh, signs and symptoms, and thus emergency care they delay. Can you hear me?
Yeah, actually we
Hello.
lost your connection in between, so we were
So
unable
I
to.
repeat. Yeah, I repeat. Emergency care is only for severe infection problems or injury. This is the common mindset, and
Right.
they sometimes say that my problem is not very severe. I should consult to my family doctor first, then go to a specialist. And there is a mindset that emergency care is expensive. Why should to spend so much money on my health? Sometimes there is a that my problem is related to food. My problem is related to like some stress, inadequate sleep. So they try to delay the important warning signs and present late.
All right. Thank you so much for highlighting few misconceptions. But I'm sure in India there are so many misconceptions in families for many diseases. Now moving to Dr. Rajeshwar Singh. Sir, how does early cancer diagnosis change treatment options, cost, and survival outcomes?
Yes, this is a new paradigm that we should detect cancer very early. Now, early detection is why it is useful is firstly, your body is in good health, your liver, spleen, kidneys are in good health, so you can be given treatment and side effects become very easily. Now, early treatment means that you will have a localized disease. What does that mean is that you'll have a short treatment. You can have only single treatment because cancer has got chemo, radiation, and surgery. If it is detected very early, you can have only one treatment, not involved other treatment. So treatment is very early. If it is not localized, it is spread slightly, then you require to have a multimodality treatment, which involved all the three arms of oncology, that is surgery, radiation, and then chemotherapy. So as the treatment is more, the side effects will be more. So early diagnosis is important because early diagnosis mean a curative intent of treatment. That is, you become cured of your cancer. You have heard about people like our cricketer from here. He had a early cancer and then he got treated and he became a normal person thereafter. He has a normal lifespan. He has a marriage. He played again World Cup. So that means that early treatment you can carry on with your normal life after treatment. But once it become advanced stage, that is generally in one first, second, and third stage, we can cure the patient. And once the patient becomes fourth stage, the cure becomes lesser. So initially is a curative treatment, and then the stage 4 becomes a palliative treatment, where the treatment lasts longer. So longer treatments, what does that mean? That means the cost of treatment becomes very high, whereas in shorter treatment cost is very less. Apart from cost, the side effect of treatment in a shorter duration curative intent treatment is very, very less. And whereas in palliative or prolonged non-curative treatment, where multiple modalities are involved, that is surgery, radiation, and chemotherapy, cost can go higher. Apart from cost, important factor is the quality of life. A quality of life of a early disease who has been curatively treated is very good. It is like I said, it's like a normal human being. Whereas the in case of advanced stage, the curation, the quality of life goes slightly lower. Though we have newer drugs which are coming, newer immunotherapy, targeted therapy, these are the precision oncology which give very less side effect, but still they are there. So it is very important we catch them young. It is treatment is given early and it is a curative treatment. It should not be delayed.
Yeah, I think thank you so much, sir, for highlighting. If we know early, there are more chances for curing the disease early and recovery completely. Now moving to Dr. Ankit Amar Gupta. Sir, in your experience, what are common myths that cause patients to delay neurosurgery consultations?
So I can probably think of three common myths which I do encounter in my common practice. The first myth which patients generally have, if they have a brain or spine tumor per se, that it is an incurable problem. So they don't distinguish between a tumor and a cancer. So tumors can have many grades. It can be a grade 1 tumor, grade 2, grade 3, grade 4. And depending on the grade of the tumor, the patient prognosis can be altered and varied in different presentations. Some patients who have a grade 1 tumor can undergo a surgery and be cured of the tumor and can have a normal lifespan. Even for patients who have advanced degrees of tumor, grade 2, grade 3, can have 5 to 10 years of almost normal life if they are properly screened early and treated early. For grade 2, 4 tumors also, patients feel that there is no cure to the disease, and they, rather than undergoing a surgical decompression, they choose to undergo a common alternative medicine treatment like homeopathic medications, which alter the patient's prognosis adversely, and they don't seek a medical surgical treatment. With proper surgery at a timely intervention, the patient can have 2 years of almost near normal life and functioning, which, if they forego the treatment at a proper time, their lifespan can reduce to as low as 1 or 2 months. The second myth that the patients they generally have is that any surgery which is performed for a brain or spine leads to a permanent damage. That is not true. With current advanced techniques that we have, we use intraoperative monitoring and neuronavigation, and our goal of surgery currently is not mainly radical excision of the tumor mass, rather than giving a patient a maximal safe resection so that he can have a near normal life and a good quality of life in whatever number of years he has left. The third common myth is the patients seek alternative modes of therapy like homeopathic medicines instead of seeking proper allopathic care and radiation care and proper medical oncology. So these things are adversely required for all tumor patients, and if they are not taken at a proper time, the patient overall outcome and prognosis becomes really bad due to delay in treatment.
Thank you, Dr. Gupta, for highlighting the breaking the myths which are very common in India. Now moving to Dr. Akash, sir, how does delayed diagnosis affect treatment outcome in liver diseases?
Yes, so as I already told you, liver disease, most common liver disease, what we see commonly in our OPDs are two main liver diseases, which are fatty liver disease and alcohol-related liver disease. Viral illnesses like viral hepatitis B and C, they are getting less common nowadays because of the early treatment options available now from government. Also they are providing free drugs for these viral illnesses, so people are not getting these much diseases nowadays. But two main problems are fatty liver disease, going on to develop cirrhosis like liver fibrosis in the later stages, and second is alcohol related liver disease. So obviously these patients, those who are consuming alcohol in very high amounts, they don't usually go to the practitioner for their addiction problem. So families need to, patient would not, himself or herself tell you कि मुझे ये addiction का problem है, I need to, leave, stop using alcohol. So families need to decide that yes, this patient requires help. He or she should be brought to the practitioner so that alcohol should be stopped early, so that वो liver disease वाला advanced stage में वो ना पहुंचे. सो अर्ली स्टेज में ये सब चीज करेंगे तो लिवर डिजीज एडवांस स्टेज में ना पहुंच के अर्ली डायग्नोसिस एंड ट्रीटमेंट होएगा. सेकंड अगेन इज obesity and fatty liver disease. So fatty liver, it is very prevalent, almost up to the tune of 30 to 40%. आप अगर अपना फैमिली में भी स्क्रीन कराओगे, you will see 70 to 80% would have fatty liver. So fat in the liver is very common, but up to the grade of grade 2, grade 3, 60 to 70% liver is occupied with fat. And obviously these patients, या ये जो individuals हैं, हमारा lifestyle ही ऐसा हो गया है, हमारा खान पान ही ऐसा है, we use more of junk, more of ultra processed food, we don't exercise, and more of a sitting job. Most people usually do, they don't exercise, they don't go out. And then again, social gatherings, use of alcohol, drugs, smoking, they all cause, fat in the liver. So ultimately, over the course of time, this fat in the liver leads on to cirrhosis. So early diagnosis, अगर fatty liver में weight control में नहीं होएगा, तो ultimately this will lead on to end stage liver disease, and patients usually land up with cirrhosis. जब मैंने आपको पहले भी बताया, the symptoms of cirrhosis are jaundice, swelling in the legs, पेट में fluid in the abdomen, and these patients usually then have final treatment as liver transplant only. So early diagnosis, early preventive measures so that patient does not land up in end stage liver disease is very important. People should understand they should control their weight, they should control their diet, because ये आज problem नहीं देगा, it will give the problem after 10 years, 15 years down the line. So the person who is 30 years old would have end stage liver disease like in his 50s, if he keeps on gaining weight and that lifestyle keeps on following that lifestyle. So early diagnosis is very important. Preventive measures have to be taken so that weight control, diet should be optimized. And these patients not only develop liver disease, they develop what is called as metabolic syndrome. They have high risk of cardiovascular disease, they have high risk of diabetes, they have high risk of stroke. So these all these diseases can be prevented once you get your lifestyle better and control your weight, cut down alcohol, cut down drugs.
Yeah, thank you so much, Dr. Akash, for breaking it in simple terms and how families also needs to be attentive about these things. Now, moving to round four, where we will be highlighting on the questions of prevention, preparedness, and public awareness. So, my first question will be to Dr. Navneet. How can primary care physicians and families work together to ensure early medicine consultations?
So, ma'am, the primary healthcare system of any country is very important in actually saving the patient the brunt of the disease and of the finances. So, we should understand that the first contact with any healthcare is the primary healthcare. So, early consultations with the primary healthcare physician or the family physician plays a very important role in early diagnosing the illness or the infection and preventing the infection. So, the preventive measures are also told by the family health physicians, and the early diagnosis is also initiated by referring to a specialist by the family physicians. So, it is very important to have a family physician, number one. Point number two is it is very important to access or have the access to that family physician in small issues, in getting knowledge and in the prevention. So a person who is aware goes to a family physician early, and if the family physician checks the red flags early and refers them to a specialist if required, or gets preventive health checkups done at that point of time, that is the major source where early recognition of the illness is made and the patient's life or morbidity is saved. So, family physicians and early preventive measures play a very important role in the health of the patient or a particular person.
Yeah, right, Dr. Arora, for highlighting this point that small things are also important for bigger diseases. Now, moving to Dr. Chetan, sir, how does early emergency response reduce the need of prolonged ICU care?
So early stabilizing the patient means early uh, maintaining the saturation, maintaining the airway, maintaining the blood pressure, circulation. So it prevents the escalation of organ dysfunction. So organ dysfunction can be uh, halted, or you can say stopped by early maintaining the circulation, airway, and breathing. Then there are few bundles like sepsis care bundle or other bundles when we can prevent the by using non-invasive ways we can prevent the invasive things like sometimes in patients of COPD or airway reactive disease, using NIV on time can prevent the invasive ventilation. So, and hence preventing the invasive ventilation means we can prevent the long-term complications, because sometimes weaning a patient from a ventilator of COPD becomes a challenge. So the moment you try to act early, you can do away with non-invasive ways, lesser intensive ways. The moment the patient is delayed, the patient has to go for invasive ventilation, invasive and extensive treatment. There is a saying that the right treatment at right time can decrease ICU stay by 1 to 2 days average. And even all complications are decreased. If the complications and stage decrease, the financial burden and the overall outcome of the family, of the patient, of the and the family and the society is improved. Because staying in an ICU is not only about the patient's complications, it is also about the financial burden on the society as well as the patient. So early definitely helps in preventing few illnesses, early management.
Right, Dr. Goyal. Now moving to Dr. Singh. Sir, in your experience, what role do screening and routine health check play in improving cancer outcome? As we discussed earlier, also that early diagnosis is important. But apart from this screening and routine health checkup, and how can we create more awareness among patients?
See, cancer is spreading very fast, and it is a national health problem now. And the only way we can deal with it to detect it early and treat it very fast and at a lower cost. So for this, it is important that some screening tests are become the part of the public health, which are there in all other countries. We do not have in this country. So these screening, what are these screening tests? These tests are those tests which are done when you have no symptoms, you have no problem, you are normal, but you are likely to get cancer. So we detect those people who are likely to get cancer so that they are detected early and we give early treatment. So robust screening tests are there for 4 or 5 diseases, which cover roughly about 50% of our cancer burden. The most important being the breast cancer screening, in which the ladies, they should do self breast examination once a month with the palm of the hand and to see any lumps in the breast or in the armpits. Then they should do mammography every yearly after 40 years, or alternate years they can do after 40 years. They can detect very early disease. Whereas who have got a family history, who are high risk, they should do yearly. I can give you example of this breast cancer. America, there is a cancer screening program. So because of which the cure rate in breast cancer are 90% in America. It's the commonest cancer in the world at this moment. Similarly, in India, it is the commonest cancer in the ladies, and the cure rates are 60%. So we have to improve from 60 to 90% by doing this breast cancer screening. Second important thing is the cervical cancer. This is the second most common cancer. In this simple pap smear test, after 21 days on alternate years should be done, and this should be done till 65 years. And if we add to it a vaccine, the cervical cancer vaccine, so they can be 100% cure of cervical cancer. But since we are not doing both of these things, it is the second most cancer in female with a lot of consequences when it becomes very advanced. Then for males, we have for prostate cancer, simple PSA test is done after the age of 50 years. And if you have a family history slightly earlier thereafter, for colon cancer, जहाँ बड़ी आंत का cancer जो होता है, we should get colonoscopy after the age of 55 once in 5 years, which can detect very, very early disease. Apart from that, those are chronic smoker who have smoked more than 15 years, 2 pack a year, they should at least get one low dose CT scan after the age of 55 yearly to see they don't get lung cancer. So these are the common cancer. They do not cost too much to the patient. Apart from that, you are doing routine testing with your consultants, to your physician, with the doctor, with routine tests like blood test, ultrasound, and X-ray, which should be done every 6 months to 1 year, and they can detect also many cancer very, very early. We're not saying everyone should get it, but most of the people should try to do. These are not expensive these days in our country. Very cheap tests are there. So what does this screening test does is it detects very, very early cancer. The cost of treatment is very low. The cure rates are very high, and they should form the part of our national health policy that everyone should get cancer screening. Otherwise, the cost of treatment and the cost to the country is going to be very high because it is increasing. We have seen that this year the statistics from USA has come. They have decreased the death rate of cancer dramatically by 22% in last 1 decade. The reason being they are doing screening tests for all these 4 or 5 cancers which I told you which are common, and they're getting very early cancer, and they're treating with very less cost and side effect. So early detection by screening test is very, very, very important.
I think what conclude here is we should do routine checkup regularly, especially for screening. We should include in our routine checkup. Now moving to Dr. Gupta. Sir, how does early intervention reduce long-term disability in neurosurgery cases?
So let me divide this answer in two parts. For the first part would be an emergency setting. If the patient has any sort of a large mass in the brain or a bleed in the brain or spine which is causing a acute deficit, there every minute counts. We have to do intervention as early as possible. There is a saying, time is brain. So every minute lost leads to the patient's overall bad outcome. So we have to intervene as quickly as possible. Now to the second part, for any patient who has a tumor or any other neuro-oncology related problem, the earlier you diagnose the patient, the earlier the screening is done and the patient comes to the practice, the lesser would be the grade of the tumor, the lesser would be the critical structures of the brain or the spine that are involved, and hence the overall recovery and prognosis of the patient at an early stage of the disease will be much better than a patient who comes to us at an advanced stage of the disease.
Thank you, Dr. Gupta. Now moving to Dr. Akash. Sir, what role do lifestyle and diet play in early prevention and disease control?
Yes, so I've already told you that diet and lifestyle is the that mostly people get fat liver, obesity, and ultimately they get most of the liver diseases and GI diseases. So again, people should avoid alcohol. People should stop smoking. They should get their weight in check according to what is their height. They should not eat. People should not eat much of junk, much of ultra processed food. They should eat more of wholesome foods, like more of cereals, legumes, vegetables. Uh, as per, especially for liver diseases, people should, if they can, they can consume. They should consume 1 or 2 cups of black coffee per day, without sugar, without milk. That would help reducing the fat in the liver. And these are the basic things. Get yourself screened. If you are not a high risk individual, if you don't have diabetes, if you don't have cardiovascular disease, you don't have a family history of liver disease, you're just a normal individual. So get your weight in check. Stop all this junk and ultra processed food. Do some physical activity, any kind of physical activity, any sports, any cycling, biking, hiking, anything, gym. Just get your weight in check. And once in a year, you should get your labs done. Your CBC, your LFTs, your ultrasound, and get your routine labs done once in a year. Most of the young people, they do have health insurances nowadays, which usually cover their these lab investigations. So they should get their labs done screenly once in a year, and you should avoid these things and get your weight in check. That's it.
Thank you, Dr. Akash. Now moving to our final round, where I'll be asking one key takeaway home message which you all want to give to our audience, so that we can create a lot of awareness towards the public and laymen. So, moving to Dr. Arora, sir, what is one preventive health habit you believe could significantly reduce late stage presentation?
So, one preventive health habit which I would like to mention is awareness. Awareness is such a thing that if you know about the complications or if you know about the illness which spreads, that is the thing which saves you from the hospitalization and from unnecessary complications. So there was this saying in a popular TV serial, Game of Thrones, that knowledge is power, and I would actually like to reinforce it over here. That if you know what is happening now with the advent of many AIs and with the online availability of multiple resources, authentic resources like up to dates, the PubMeds, and the research model of chat gpts and the Gemini, there is a lot of information, lot of authentic information which is there. So by being aware, you will be able to recognize early that when you seek medical advice, and you will also be able to recognize the complications your probable family members or friends are facing or might face in probably the next 72 hours. And awareness, I think, is the most important preventive measures which you can take right now.
Thank you so much, Dr. Arora, for this powerful message. Now, from Dr. Goel, sir, what one message would you give families to improve survival during medical emergencies?
So, first of all, do not panic. This is very important. Act
Right.
immediately by checking for the response of the your patient. Call for help. I strongly suggest that we should be aware of nearby medical services, medical help, emergency helpline numbers. Then, if required, we should be at least learned about the hands-only chest compression CPR. This is important for everybody. In the now we have a program that school students are also learning the CPR, and then we have to also learn about two critical points about the health, which are warning signs. Just like Dr. Navneet has said, Dr. Akash has said, Sir Rajesh sir has said, we should be also aware of few warning signs which the patient should not take it lightly and seek medical help immediately. Then we should also be have a few things at home so that we can start our like immediate treatment at home. If patient is like able to take a pill, he can be given one or two pills at home, like for a chest pain. Discipline is the answer. So we should be having a few important medications at home. Patients need to have a competent tablet at home, but definitely on the advice of doctor, not a blanket advice. So these things are important.
Right. Thank you so much, Dr. Goel, for highlighting why education is also important for various diseases. Now, moving to Dr. Singh. Sir, what single message would you like the public to remember about early cancer detection?
First is cancer is curable. Early detection save lives. Get your screening test regularly, and please never ignore persistent symptoms.
Thank you, sir. Now, moving to Dr. Gupta. Sir, what advice would you give families when a sudden neurosurgical emergency occur at home?
Dr. Chetan highlighted the practice of not to panic immediately. Patients might have seizures. That time, you should give patient adequate room. You should maintain a proper airway. We should not put anything like honey or any other practices that they follow during the active episode of seizure. And you should seek medical help as early as possible.
Thank you so much, Dr. Gupta, for breaking it in simple terms and highlighting the importance. Now, moving to Dr. Akash. Sir, what one step can families take to ensure timely medical interventions for GI or liver issues? You are on mute, Dr. Akash.
Hi, sorry. So early step would be, keep your weight check, keep your diet in check, no alcohol. And in case you get any of early signs, as I've told you, like jaundice, swelling in the legs, bleeding from any side, loss of weight, loss of appetite, reach early to the hospital or your, any medical practitioner early, so that these diseases could be diagnosed early, you can be treated early.
Thank you so much, Dr. Akash. Thank you all the doctors for sharing such valuable insights drawn from real clinical experience. Today's discussion reminds us that early diagnosis is not just a medical decision. It is a responsibility shared by clinicians, families, and health systems alike. Timely intervention has the power to change outcomes, preserve quality of life, and save lives. Thank you to everyone who joined us and contributed to this important conversation. And once again, thank you so much, IHW Council, for organizing this and for Paras Health for supporting this initiative.
Thank you.
Thank you.
Thank you, ma'am.
Have a nice day.
Thank you to the organizer.
Thank you so much, everyone, for joining.